Arterial blood gases, ABGs, are one of those things that scare a lot of NCLEX students. But once you understand what the numbers are trying, ABGs become one of the easiest questions to score on. So let's slow it down and make this make sense. When you see an ABG question, don't rush to the answers. Start by asking yourself one simple question. Is this patient acidic? Normal pH is around 7.35 to 7.45. So anything below that tells us the blood is acidic, and anything above that tells us it's alkaline. Once you know that, the next question is, where is the problem coming from? Is it the lungs, or is it a metabolic issue? This is where CO2 and bicarbonate come in. CO2 is controlled by breathing, so when CO2 is off, you should immediately think respiratory. Bicarbonate is controlled by the kidneys, so when that's off, you're dealing with a metabolic issue. Now, here's the part students usually miss. Compensation. The body is smart. If one system is failing, another system tries to help. So if you see one value abnormal and the other starting to shift in the opposite direction, that tells you the body is trying to balance itself. And NCLEX doesn't just want you to recognize the imbalance. It wants to know if you can connect it to the patient in front of you. That's why they give symptoms like rapid breathing, confusion, anxiety, or extreme drowsiness. Those are clues that the body is struggling to maintain balance. Let's walk through an example together. Say the ABGs show pH 7.30, CO2 50. Right away, the pH tells us the patient is acidic. Then we notice the CO2 is elevated, which points us to the lungs. This is respiratory acidosis. The bicarbonate is still normal, so the body hasn't had time to compensate yet. So what matters most for NCLEX? Not labeling the disorder, but what you do next. This patient needs airway and breathing support. You assess oxygenation, check respiratory status, and intervene early. Because NCLEX always rewards the action that prevents harm first. What's wrong? Why is it happening? What keeps the patient safe? Now I want you to practice. Here's your ABG. pH 7.48, COC 30, HCOC 22. Take a moment and ask yourself, what direction is the pH? Is the problem respiratory or metabolic? And most importantly, what would be your priority nursing action? Post your answers in our Telegram community so we can review them together. That's where real learning happens. The link is in our bio, and come practice with us.